So today we're going to talk about visual snow, and the snow people see what they describe as snow or static, like a broken television screen. It's diffuse and bilateral, and it kind of just fills their visual field. There's a snow simulator online that you can go Google, and the patients can choose their flicker rate, the size of the grains of snow, how fast it's blinking, all sorts of parameters. And it's mostly useful to show patients that other people have what they have, but also it lets the patient show you in a visual format what they're seeing. The visual snow can come on acutely. It's usually chronic. The patients are usually a little bit hyper attentive. It's diffuse, bilateral, and the same between the two eyes. It doesn't normally cause any degradation in visual acuity. The pupil exam and the rest of the structural eye exam is normal. The imaging studies are usually normal. You could do an EEG to look for seizure activity, but almost always it's normal. And PET scans and functional MRI scans in the visual snow people have shown hypermetabolism in the lingual gyrus. So there is a radiographic correlate to what they're describing as visual snow. It's not clear what causes this. Some people believe it's migraine. Some people feel it's like a subclinical form of seizure. Other people just think it's a gain problem, so the gain is not set properly, and so they can see what you can't see. And in reality, I think normal people can appreciate snow. If they stare at a wall that's blank like this long enough, you'll see the kinds of things that they see and describe as visual snow. Most people just want reassurance that it's not something bad. I think there have been treatments that have been tried, Diamox, Depakote, anti-seizure medicines, Topamax. All of these things have been tried, but nothing has really proven to be a cure. If you look at the diagnostic criteria, it requires that you don't have anything else. You have to have a normal examination. And some of the patients actually have migraine criteria. And some patients actually have palinopsia, where they have the perception that the image is repeating, often a trailing palinopsia. For example, where your hand is moving, they can see 5 or 6 of these hands. Some of the patients have had exposure to hallucinogens. Those are a different kind of visual snow, which is a hallucinogen persistent perception disorder in the DSM-5. I think that most of these patients just have hyper awareness of what is a normal phenomenon, but I believe them when they say they are symptomatic. And so if we can turn down the gain with medicines, I think it might be helpful to them. We also use the filters. I have no proprietary interest, but we like the Axon Optics FL41 filters. Presumably there's some mediation of the trigeminal thalamic pathway here, and so FL41 filters sometimes helps the people adjust. So I believe visual snow is real. It's bilateral, diffuse, it's constant. It's described as snow or static in the visual field of these patients. They have normal exam, normal imaging, and no evidence of seizure activity, and you could try anti-seizure medicines as a trial.